So good afternoon and welcome. My name is Carrie Craven. I am Administrative Specialist for KCMPA, and we thank you for spending time with us today. First off, I'd like to ask that while the webinar is in progress, that you mute your phone lines so that everyone can clearly hear the presentation. I'm actually already hearing some rumbling in the background, so if you would please do, if it's a cell phone, just hit mute. If you are on a landline, it's *6 on your phones. If you're logged in on a laptop, you can mute your microphone. If you have any questions during the presentation, you can ask those via the chat window, or you can wait till the end and ask it when we open up the phone lines for Q&A. Joining me today is Cindy Campbell. She is Director of Clinical Strategies for KCMPA, and Cindy is going to be talking about quality improvement initiatives that we have in the works. Cindy?
Thanks, Carrie. So I want to thank everybody for taking your lunch break to join us for the webinar today. So today, as Carrie said, we're going to be talking about our quality improvement initiatives, and I just thought it would be really good for us to kind of go through, a lot of the different programs that we have in place for the specific practices, the ACO practices. And one of the reasons is, that we have some flow of people, in and out. You might have some new people that may not be aware of everything that we have together. And then sometimes, things kind of appear a bit fractured, but I would really like to kind of get a good comprehensive big picture of all of these different pieces of the puzzle and how they all come together in support of what our goal is. So before we get started, I just want to do a quick review of upcoming webinars. So next month, we're going to be talking about KCMPA and who are our members. We've had some new members joining us at the start of the year, so I think we just want to get everyone updated on who all are part of our organization. And then in May, I want to talk a little bit about our chronic care management program that we will be starting through KCMPA and give everyone kind of how that program is going, what we've found, and give everyone just, an update on that. And then in June, I'm hoping that we will be able to give a webinar on our recent GPRO submission. I'm not sure if they will be back from CMS at that point in time, but if they are, then hopefully that's what we'll be able to do. Okay, so the things that we're going to be talking about for today's webinar is I want to quickly go over the ACO financial and quality performance, quality improvement support that's provided in the practice, and then I want to talk a little bit about what our future vision is. And then we'll have some time for Q&A and further thoughts as well. So our ACO financial and quality performance. So first of all, what are the expectations that we have? Well, CMS has expectations that we will provide highly coordinated care to their Medicare patients. They expect that we will work towards avoiding unnecessary duplication of services, that we will provide for our patients with chronic conditions in a more comprehensive manner rather than a sporadic, when they get sick type of care that we've done in the past, but looking more at how we can keep them supported along the timeline and keep those conditions from either worsening or having exacerbations. And then if we succeed in both delivering high quality care and spending healthcare dollars more wisely, to be able to share in that savings that we've achieved for Medicare. So basically, if we can meet certain goals and financial goals and measures, we get the savings that come back to us and they get divvied up between the ACO practices. if we meet these certain conditions. So that's just really high level, but it's really kind of, bringing it down to these are really the specifics of it. And I want to talk just a minute about GPRO. I know you've heard that term a lot here over the past few weeks. And so GPRO stands for Group Practice Reporting Option. And this is basically the time frame when we submit all of our quality measures into CMS. So we have a certain time frame to do it in, and that time frame actually closed last Friday. And we submitted all of our quality measures in. And so if you hear the GPRO reporting, that's what it stands for, Group Practice Reporting Option. It's done through our health metrics system, which has a tool called SQI, which stands for Solutions for Quality Improvement. That SQI is connected to every practices in the ACO, their EHR, and it looks at those patients. It looks to pull out those specific ACO measures that we can pull out from the patient's record. So just to kind of make that as simple as we can. That's exactly what it's looking at. It's kind of just an eyeball looking in and trying to pull out those measures on those specific patients, and then that's what gets submitted to CMS. Okay, so our quarterly report. So as you know, this is something that we have started from the KCMPA ACO level. And it gives us the opportunity to meet on a routine basis with all of the ACO practices, just to give them a snapshot and kind of an update of where they are. I always like to remind them it's not a grade card, this isn't a judgment, this is giving them a report to say, this is where you are on your ACO measures. This is what it looks like with your high-cost patients. These are your patients that are using the emergency room frequently, and also it provides where you are with your financial benchmark as well. So what we're going to be changing that report somewhat. We're going to be standardizing some of those reports so that it is it's going to show all of the clinics, so you will be able to see where you are in line with all of the other clinics with the ACO measures, and then a few other reports on that as well. So just get prepared for that to be coming. Terry and I are working on that now, and then we will be making appointments to come and meet with your providers, and to review those reports. Okay, so now we're going to talk a little bit about what we actually have for your quality improvement initiatives, the support that we actually provide in the practice. And so the first one I have on here is the tobacco cessation. So tobacco cessation will meet the ACO measure number 17, which is the tobacco use screening and intervention. So the way we started this, and if anybody is not aware of what this program is, we do have the information in detailed. It's on the YouTube video, and we show all of the tools, and we just provide recommendations on what a good workflow would be. But basically, we arrange to have information on tobacco cessation sent to every practice in the ACO from the CDC. So Carrie arranges that. Carrie ensures that every practice is getting this information on a routine basis. And then, when a patient when they're asked they do use tobacco, then they're provided this information, and then they're also given the opportunity to join the quit line, which is provided from the Kansas and the Missouri Department of Health, and they can get a assortment of different tools and plans, quit smoking plans, and other information in order to help them with that goal. And once again, if you need any further information on that, please don't hesitate to ask myself or Carrie, and also that link directly to all of that information is in every newsletter that goes out. So we're going to go down to the pharmacy support. So for pharmacy support, we have TRIA. TRIA is a company that supplies clinical pharmacists. They will do medication reconciliation. They will do comprehensive medication review. And really where this falls into the domain for our ACO measures is in that patient safety domain, where we're ensuring that patients are taking their medication the right way. They're taking it the way that it's been prescribed, and that they understand what they're taking and how to take their medication. So this is also helpful with transitions of care, because when a patient comes out of the hospital, and one of the things that needs to be done for these patients is med rec, and so TRIA can do that for the clinics. I know a lot of the care coordinators have told me what they do is, when they're following up with the transitions of care, they make that referral to TRIA, and then they just document that med rec performed by TRIA. Another program that we help support in the practice is the diabetic support that is going to meet our ACO measure number 27, hemoglobin A1C, poor control. And we do this by providing Melissa Leslie. She's our certified diabetic educator, and she is available to work with all of our ACO clinics. So if you aren't currently working with her and you would like to, please let one of us know, once again, Carrie or myself, or you can reach out directly to Melissa. There is the resource, or the referral is out on our webpage. Plus, if you get the newsletter, there is a referral access right on that newsletter, or once again, you can just shoot me an email and we can get that to you. And then we also offer support for those patients that have an excess BMI. So that's going to lead us to ACO measure number 16, BMI screening and follow-up. We actually, for our ACO, we do a good job on the BMI screening. What we don't do so well is on the follow-up piece. A couple of different things that may be, partly is the capturing of that piece. And then, what do you always do with following up? Following up could be a number of things. What we do supply is a dietitian. Once again, that would be Melissa Leslie. She is a dietitian and our certified diabetic educator. And we have also partnered with a company called Simplified Health. You'll start seeing more information about Simplified Health. The person that runs this, her name is Rachel Darrow. She is a certified exercise physiologist. And so once a referral comes to her for a patient, she will come to their home and start working with them to devise a customized and individualized exercise and health and fitness plan that will be, according to that patient's condition and their resources and, what they have available to them. She is also going to be presenting at the next, at the Care Team Consortium next week. So you'll be hearing more then. Okay, some additional support that is provided in the practice from the KCMPA level. And this is another new program that we have, the Chronic Care Management Program, and this is going to be supporting that CPT code of 99490. So many of you are really familiar with this code by now. We've done a lot of education on it. We've done a webinar. I know we've talked in depth at the Care Team Consortium about the chronic care management. One of the things that at the practice level that we have found, and this isn't just in our area, this tends to be kind of what I'm hearing nationally, is it's a really difficult CPT code to carry through, basically because it's going to take, it has a lot of steps to it. There's a lot of different parts and pieces that have to be taken into consideration in order to maintain this and to actually be able to bill for it. And it really is kind of a full-time job. It takes someone pretty much full-time to just do nothing but focus in on, have we met all of the requirements in order to submit for billing, and really doing a lot of extra work on this. So in order to support the practices, we have started that we are in the very early works of the Chronic Care Management Program. We have hired an LPN to help us get this going and off the ground. Her name is Rachel Stevenson. I'm going to be getting her out to meet some of the practices next week. So we aren't going to be wasting any time. We're going to be jumping right into this as quickly as possible. So if this is something that your practice is not aware of yet and you would like to be a part of this, let me know. There will be a revenue sharing piece that goes along with this. So a piece of the revenue would come to KCMPA, and a piece would go to the practice. Okay, so additional tools and support that we have available to the practice are the Care Team Consortium, and I know many people already are coming to the Care Team Consortium. I would love to be able to increase that number. It's one of those meetings where the more people that we can get in, the more sharing that we do of stories and resources, the more networking, and and that's the best way I think that we can learn from each other. And how did so and so do it at their practice? I would, this has been a struggle at my practice, so I would love to learn how other people are doing this at their practices. So just those type of issues. And also, we're building the healthcare neighborhood, and we're using that forum to help bring in different resources within the community. We've had many speakers that were brought in from the actual care coordinators themselves from the clinics that use these resources and really want others to know about them. And also, it shares an awareness of what resources and support is out there for patients. For my life, I've done that. And then newsletter. We have a monthly newsletter. I'll just tell you right now that we are having some discussions around making this a newsletter that will come out 6 times a year. So it would be a little bit longer, and include a little bit more information. Right now, it is going out on a monthly basis, but we still want to keep the information in it, where we really try to tell you about all of the new things that are happening in the ACO, or actually in KCMPA as a whole. We talk about what's happening in the clinic. We talk about PCMH, And as well, once again, we provide the additional, those links to all of these different programs and to be able to get information directly on all of these programs. The one thing that I didn't mention in here is the list of community resources that we have out on our website. That's also available, and a link is directly there in the newsletter, so you can just click on that. The monthly webinars. So these monthly webinars, once again, are part of our quality improvement support that we want to provide to you, to talk about different things that, you might want more information on. So it could be things such as, annual wellness visits, the transitions of care. We've done them on, the chronic care management code. We've done on end of life. That's a big topic right now, and Medicare, it has decided to start reimbursing with the new year and the new fee schedule. They are going to be reimbursing for end of life discussions that's happening at the primary care level. So that's really important things. I mean, how do we start getting those discussions to happen? And then we have a YouTube channel, and as well, that YouTube channel, that link is directly in our newsletter, and that YouTube channel provides different presentations that we have done on our quality programs, where you might want more extra information. So please take a look at some of those. And one more thing that I had in my head, and I don't remember what it was. Okay. So this is our future vision. And these are some of the things that we have been talking about here at the organizational level. And I thought they would be really good to share with you all, just so that you have an idea of, where we would like to take things and where we would like to move to. What is our vision? One of the pieces that we feel is really important to bring to all of you is, at some point, is a behavioral health professional that can work with your patients in the clinics. I know we've had this in the past, and we've had to kind of pull back and relook at what our plan is and financing. And so this is something that we do want to bring back to the clinics. We have heard from the clinics themselves that this is something that they would like to see. And so, of course, you're the biggest voice for us as far as, what we will put in place. Expanding the chronic care management program. This is another vision that I have. Once we, get this up and going, that we will be able to expand this even more. I look at it as we have about 13,000 Medicare beneficiaries in our ACO. Medicare has said that approximately 3/4 of all Medicare patients have 2 or more chronic conditions, which means that really a good chunk of those patients could be taking advantage of our chronic care management program. So hopefully, we can make a big dent in that and really capture those patients by expanding that program. We want to expand our CDE resources. We, Melissa is being used quite a bit, which is wonderful, and that's exactly what we want. And so that leads us to the discussions of, how can we even more expand that program and that resource that's available to all of you. So we have a couple of options, couple of things that we are, considering and looking into. But if it comes down to it and, at some point our funding can support it, then, we would like to be able to bring on another dietitian as well, another diabetic educator. Okay, provide patient outcome data. So one of the things that the board has asked us to do is to, be able to give some really good, concrete data that shows outcomes of all of these different programs that we have in place. So what are our patient outcomes? So this is another piece that Terry and I are going to be working on and building out a really good, quality tracking and data sharing tools and dashboards and getting that out to all of you so that you can really have a good idea of where we are going with these specific programs that we have in place. So, and I put the question here, what else would you like to have? Because, once again, I want to hear back from you about what is it that you see in your clinics, in your practice, that we could provide or do a better job of providing from the KCMPA level. And so, if anybody has any thoughts right now and you want to share that, then please feel free to put your hand up. If you would want to just, shoot me an email or, call me or something like that, absolutely. Any format is fine. We just want to be able to hear back from you. So does anybody have any thoughts that they want to share right now?
Mute your lines. You can push *6.
I'll give you a second to think, just in case I kind of sprung that on you. Okay. Well, if there's something that you think of that you feel like would be really beneficial for us to provide, then please just, feel free to call me or send me an email, and, we definitely will take a look at it and see what we can do, how we can, figure that into our plan. Oh, Mary, Kennedy just said, I would love to be able to have a social worker available. Yes, definitely. And what we hope is that we can bring in a social worker that has a behavioral health certification, so that we can kind of, to kill two birds with one stone, and have a social worker available at the same time as that behavioral health professional. So yes, thank you, Mary, for that. And I could just make that clarification as well. All right, anyone else? Okay, well, like I said, if there's anything else that you think of, please just call me or shoot me an email. That would be great. Okay, I want to take a few minutes here because I kind of covered things pretty quickly, but I want to make sure that there's no questions, that everybody was clear on everything that we talked about. And the other thing is, too, if there's some of these things that you're not aware of that we're doing and you want more information, then please let me know, and we will definitely get you up to speed. So any questions? Any thoughts? Okay, so we don't have any questions. Once again, anything comes up, please feel free to shoot me an email, and I will certainly address your question. Okay, so for our webinar for next month, will be on April 19th. It'll be on Tuesday, April 19th. And we're going to be talking about KCMPA, who are our members. And so that concludes my presentation today. If there's no more questions, then you can all go about your day.
Great recap, Cindy. Thank you very much.
Thank you.